joining. I'm sure we'll get a few more people. These webinars, as I said, we've been running these for about 18 months now. We started off beginning of 2024 and thought it'd be useful to start to sort of share some content around those essential steps that you need to kind of go through to launch and succeed in private practice from the NHS. So we have touched on various different elements of the private practice, from I think indemnity insurance to CQC to marketing to video, search engine optimization. So we are slowly working our way through all the subjects, and we've got a whole list of others to come up in the autumn. The whole purpose really is to help you avoid the common pitfalls and mistakes and to guide you through those essential steps. The idea is to save you time and money in the process by doing things in the right order and avoiding those kind of pitfalls. And hopefully, ideally, getting you launched quicker so that you can start to see those patients and start to see those revenues come in from your practice. So that's our ambition. These are just some of the webinars I mentioned before. So all of the recordings of these are available. So we've run them throughout 2024, and we've got an autumn series that we'll be announcing over the course of the summer. The webinar 16 in September is going to be about planning for retirement and exit and how to think about that, even in the early stages of when you're setting up your practice. For those of you that aren't familiar with Designated Medical, we are a full service consultancy for private practice. We don't do any work in the NHS. We are purely private practice. And we have a whole host of experts within the team that can cover everything from accountancy and finance and billing through to CQC registration, compliance, medical PAs, practice managers. And in my area of the business is the marketing and consultancy side of things. So if you're not familiar with us, please let me know and I can send through some information for you. I'm delighted to be joined today by Lavan Bhaskaran from Cinnamon Healthcare. Lavan, I'll let you introduce yourself because you do a far better job than I will. I'm the CMO at Designated Medical. You'll be used to my voice if you have tuned into these webinars before. So I've got over 25 years of marketing and operations experience of running businesses. But for the last 6 or so years, I've specialized in helping doctors set up and scale their own private practices. So firstly, when I started on my own back in 2020, and then I joined Designated last year when I joined forces with Jane. But Lavan, perhaps you may want to give a little introduction to yourself and your background.
Oh, thank you so much, Simon. Thank you all for inviting me, especially Designated Medical. So yeah, I'm Lavan Bhaskaran. I'm a GP. I've been a partner now for up to 16 years now. So thoroughly enjoy my job in the NHS. I still do NHS most of my week, but in the last, say, 5 to 6 years, I set up privately on my own, and just recently we've just set up a group practice in the last 1.5 years, which has been an exciting opportunity because, as you know, there's only a limit to where you can go on your own. So thoroughly enjoying that role. I still keep my leadership roles in the NHS because, of course, that's where most of our knowledge comes from, and a lot of work I do alongside pharma. So I think companies like AstraZeneca and Novo Nordisk, speaking nationally on those. But it's been a true joy and a lovely pleasure kind of being on this journey. But hopefully we can kind of pass some information on to you on how to avoid mistakes and how to get to where I've been as quick as possible.
Thanks, Lavan. That's great. And I know we've got quite a bit to go through. We hope it will be taking about half an hour today plus Q&A. So, we'll start with what we're going to cover. So today was all around, and we did an article last month on the Designated website all about the journey from an NHS doctor to becoming a business person. And when you are moving into private practice, it is very different. That journey, that big step, there's a lot of considerations. Not that the first one's being the fact that you do need to go and find your patients. You're not going to have a queue of them hanging out the door for you like you do with the NHS. So today we'll talk a little bit, and it'll be very conversational between myself and Lavan. We'll talk about sort of vision and ambition, and about making sure you're aware of why you're doing this. Why are you moving into private practice? What's the ambition here? What are the drivers? Business setup and structure is important. Understanding roles and responsibilities within the team. Whether you want to go down the CQC registration route or whether you want to go down the practicing privileges route, there are some considerations there relating to CQC. Thinking about kind of finances and income and investment, because as starting with any business, you are going to need to look at the costs, and there are some costs around setting up. We've talked about clinical operations. Who's going to run the clinic on a day-to-day basis? How are you going to find new patients? What about websites? What about social media? What about all these things that you see other kind of doctors doing that you'd like to find out more about? And then also a consideration is, what is the long-term plan here? Are you looking to, is it a lifestyle choice where you're looking to set something up in private practice as part of a portfolio career? Or are you looking to set up a clinic that you hope to scale and grow, and perhaps be operating multiple clinics over the course of the next 5 to 10 years? Depending on your vision and your ambition, obviously the plans and the costs and the revenue opportunities are all going to be very different. So we're going to hear a lot today from Levan about his journey, and we're going to keep it very conversational and stop at each section and hear about his experiences. We'll finish with a summary of our recommendations, and then there'll be a Q&A at the end, should you have any questions. So, but getting started, I think the first thing really is, why move into private practice? And, there are numerous reasons why you may want to do that. And again, we'll ask Levan here about his experience, but, more say over how you want to treat your patients. We hear this a lot, that you are quite restricted within the NHS. And I had lunch with a functional medicine doctor yesterday who was, quite frustrated with the fact that she wants to treat the patients she wants, how she wants them, but can't within the NHS. We hear a lot about burnout, and we covered that last month in terms of when you need to reach out for support and what type of support you might need. More time with patients. I think, Levan, you'll talk about the hustle, I think, and how that can be quite exciting. Additional income obviously is beneficial. But yeah, perhaps, Levan, maybe you'd like to touch on maybe some of your drivers and why you decided to move out of the NHS and into private practice for the first time.
Yeah, I guess a lot of the time people's mindset is if you go private, you're kind of letting down the NHS. We've kind of been brainwashed through our medical school training in the UK of, you need to be solid and stay in the NHS, no option out of it. But what's surprising is, although financially, paying mortgages and providing for families is an important driver, actually a lot of it is just around patient care. So just like you mentioned about the functional medicine doctor, you can imagine in general practice, we spend about 7 to 8 minutes to try and sort out a patient. So if they're very complex with diabetes, the first thing people kind of rush to is medication. Depression, sadly, higher levels of anxiety and depression in the community now. And sadly, with a consultation of less than 10 minutes, you're quite quick to offer medications because you want to help. That's morally our duty. But what can you do in terms of improving their depression and anxiety within 10 minutes? The whole discussion around sleep, nutrition, exercise, that can't, by the time you start on sleep, you're already done with your consultation. And it can be very unfulfilling. And I found now that actually trying to find the buzz, trying to find that driver, a lot of our clinicians are moving to private because actually they have that 1 hour. They can talk about turmeric and green tea and then as well as medication to really have a fulfilling consultation. So the patient walks out very happy, very willing and wanting to see you again. You feel very motivated because actually you've enjoyed the consultation, and respectfully, you're paid quite well. In my work, I'm a GP partner, 5 days a week. And in the 14 hours I work as an NHS partner, I earn that in 3 hours as a private clinician. So you can see that the magnitude of how different that is. Now, that's not to say you just become private only. The beauty is, of course, you can dabble in both. And I'd highly stress, as much as it's important to go in and consider private practice, do remember actually that actually the NHS is wonderful in terms of learning. We have such a joy with that. So do enjoy your NHS working, but of course do private as well.
Brilliant. Thank you very much for that. That's some great insight there. One of the first things we do when we meet a client for the first time, or an NHS doctor that is thinking about private practice, and that can be in any field. It could be a foot and ankle surgeon, neurodiversity, ADHD clinic, menopause doctor, functional medicine. Always the first question we ask is what's your ambition? Why are you doing this? What are the drivers? Where have you come from? What's your journey? What are you looking to do? And it'll often be about the fact that they want to treat patients in a certain way. They have an idea for a clinic. But we also ask them about, well, are you going to go out on your own, or are you thinking about doing this with a partner? Or are you thinking about a single clinic where maybe 1 or 2 days a month, or 1 or 2 days a week, or how many days a week are you thinking of kind of like, practicing? Who are the patients that you want to treat? Have a clear idea of those. Are you thinking about CQC registration? And we'll come on to that in just a second. But, it's quite a big consideration, not only the cost for CQC registration, but also the timelines. And again, Levan will tell you more about Cinnamon Healthcare's experience with CQC. And then just that idea of, end goals and exit strategy, as I mentioned before, they will have implications for your business plan. So, and what does great look like for you? That's a question we'll ask, which is, what does it look like in a year? What does it look like in 3 years? What does it look like in 10 years? And we're able then to build out a plan which will be bespoke to the client based on what they want and what their vision and ambition is. We talk a lot about value proposition, and this is essentially a marketing term, which we use quite a lot, but it's, what is your clinic going to be? What are the services that you're going to be providing? Who are the patients that you want to treat? And what are those tangible benefits that you want to deliver? And this is a series of really simple questions, but often doctors will come to us and they won't have the answers to these. And this is why, when you move into the private sector, you are going to be in a competitive environment. You will be, meeting and seeing other GP clinics or other doctors in your field. So you need to be clear how you're going to be unique, how you're going to attract those patients. Patients have a choice. And you need to really kind of understand how you're going to stand out in the market. And then this is just a really good exercise to think about, before you're launching. It's like, well, my clinic is going to be like this. I wanted to position it as a kind of premium market. I want to be more generalist, or do I want to be specialist, or am I going to be at the more affordable end? Just understanding where you are in the market, so that patients come to you, you can differentiate and make them realize why they should come to your clinic over A, the NHS, but also B, other clinics or doctors in the market. Levan, I was going to ask you about CQC. This is obviously a consideration that you went through, and I know you've perhaps been through this personally, but also with Cinnamon Healthcare. What made you make the decision that you wanted to go down the CQC route?
Yeah, good question, because it's a big decision you do have to make. I mean, I guess the easiest way would be actually to have the practicing privilege, right? So going to a mini clinic or a hospital and offering yourself. I guess there you've got to be mindful about finances. Obviously, a large chunk will go towards them, and they'll obviously have the room rent and they'll have other bits associated. And I guess the freedom is a bit lacking there. How does the marketing work? Can you make it personalized? And sometimes when they're bringing these patients, they're quite fixed in terms of what they're requesting. The freedom with doing your own CQC registration is you've got the whole wide range. So you can actually go into, weight loss clinics, you can go into functional medicine, you can go into ADHD, because you have that freedom. So yes, of course, there is a fee, and we'll obviously see that here, 1,867, which is the standard fee for one site. But you can be very clever. We've got building up to about 4 sites now, yet we're still using the one fee, and that's done by satellite. So you have one site. So Harley Street is our main site. However, we have satellite sites around. And by that way, we can kind of keep the costs low, and obviously doing it as a group as well. There's a lot of interaction. Just when we were discussing about the USP, you definitely have to have a vision. You have to have that idea of what do you want to achieve, but that can quickly quite mold. We were very much the kind of acute reactive service, and then wanting to build a subscription and kind of cardiometabolic weight loss clinics, more chronic disease. But interestingly, as we've evolved in our journey over the last 6 months, we've now kind of formulated a relationship with a group called Oru Space, who are based in Dulwich and Sutton, and now will be spreading over to Spain. And as a result of that, we're being lifted or moved towards that direction of functional medicine, and trying to do preventative medicine, so doing annual screens for breast screening and things early. So it's fascinating how, yes, absolutely, you need to have that vision, but it can quite easily shift as the journey goes. But especially with that, when it comes to companies like Oru, who we're working with, we need our own CQC there. And it's been a bonus, because as a result, you can now have another avenue of income, because you can actually bring on clinicians under the Cinnamon Healthcare umbrella through CQC.
I think it just gives you such flexibility, doesn't it? I know when we often speak to doctors, they're, well, why do I need CQC? And obviously there are regulatory reasons why you need to do that. The practicing privileges route is often a good route to start out. I think if you're just delving into private practice for the first time, to get your kind of private practice up and running and to practice somewhere else while your CQC registration is being processed is a really smart move, because it enables you to bring that income in over that course for the first 6-12 months. You can still build your website, attract people to the website, and drive them through to your CQC, so your practicing privileges, while that process is going on in the background. So but thanks, Levan, that was really useful. This is just a timeline that I've shared with you before. This is typically what you're looking at. And again, Levan will share his experience with Cinnamon. We see typically a 4 to 6 week profile, really, or timeline for, from starting up, getting everything kind of together, getting your kind of CQC application ready, getting your policies and procedures lined up, to submitting your application. So, if you're doing things, and you're working really hard in it, I'd say 4 weeks is ambitious but achievable. Typically, I'd say we see more, probably 6 to 8 weeks, because we know you doctors are very busy, you've got day jobs, and often this work can take time. Once you've submitted that application, you then got typically a kind of like a 8 to 10. I think it was at the start of the year, it's more like probably 6 to 9 months. We are seeing some cases where they've got, like Cinnamon Healthcare, an online proposition, are being fast tracked through slightly quicker. We had one doctor that we're working with up in Yorkshire who submitted her application in January, and she was expecting to get the interview in September, and she got an email through in March saying, we're going to come and see you in 2 weeks' time. So there are exemptions to that rule, and we can see the CQC are working hard behind the scenes to try and speed things up and work through that backlog. But this is a very typical time frame and a very typical kind of process that you're going to go through. Again, if this is something you're considering, then do get in touch and we can sort of talk you through this in more detail. But CQC, an important consideration. Levan, I thought it was a good time maybe for me to be quiet and for you to perhaps just talk about your journey with Cinnamon Healthcare, and also because I know you set up privately on your own first and foremost. So it would be great to just hear about your kind of perhaps your journey and some key insights.
Yeah, absolutely. I think one thing to remember is, when do you jump? I wanted to be a partner for at least a decade before I had the confidence and skill. You can go a lot earlier. I know colleagues who jumped at 3 years, but part of it is you are going to meet a clientele, especially in general practice, in whatever field you do in medicine, where they're coming to you as the experts. So you want to have that confidence under your belt. So when I'd hit about 10 years of being a partner, I moved on to set up on my own. It's at that cusp of kind of COVID, and it's about a year or so. But actually, I got my, for CQC, you do need the policies and things like that. So there is this balance that if you know it's going to be a year, do you want to be paying every month the clinical system that you're probably obviously not going to be using because you're not going to be seeing patients? So timing it is quite important. So if you have a ballpark, then look a few months before then actually starting to pay for it, being familiar with it, so that when you have your inspection, you're very comfortable with it. And Designated were great. They skilled us up. I'd obviously worked with other companies previously on my own when I did it with mock interviews and the policies and things. But Dee, my partner, and VJ, they did the interviews before. Really important just to pre-prep that. It's nothing over the top, but it's just these common things of, especially in general practice, if you're going on a home visit, who do you alert in case it's unsafe for you, and things like certain medication prescribing. So definitely the mock interview is very helpful, helping with the policies, because we just don't have the time, and knowledge respectfully as well. And obviously the team at Designated helped us out with that as well. So that, to be honest with you, it was a relatively straightforward process at the interview stage, and then receiving the CQC accreditation. And as you know, having CQC on the website, having CQC accreditation is very, very helpful, because actually there's a level of respect that comes with that the safety aspect is covered. And then from there, it's kind of, heading in the right direction. These CQC, you can always adjust things. So as a new clinic forms, or new building, or adjustment of services, you can contact CQC and adjust it accordingly. But then, once that foundation is there, that point I highlighted, that other clinicians may want to actually do private medicine, but sadly can't, because of the fact that the setup costs and going through CQC, and they may actually come under the umbrella, which can be quite a useful tool, because then you bring on extra skills, and actually you can start thinking about negotiations of funding, and how much money could they earn, how much money could we take as a cut, but it does really widen the scope. And it's been quite an enjoyable journey, and now we're at this stage where we're kind of trying to expand, planting seeds in different areas to see which one grows.
And it's quite straightforward, isn't it? I think once you've got your CQC registration, the ability to add different regulated services, to be able to change your statement of purpose, once you've gone through that registration, it's a relatively straightforward process, and just notifying the CQC of these changes. Whereas if you're wanting to do, if you're in practicing privileges and then you've got to start the CQC process, you could be waiting 9 to 12 months. So, and that's time which you're going to be losing, potential revenue and additional costs. And Levant, just talking about, going back a couple of steps in terms of, obviously we can talk about Cinnamon and how you, VJ and D, kind of got together and came up with the idea, but perhaps just talk us through sort of your journey, how you got to sort of present day.
Yeah, so yeah, graduated from UCL medical school, and from there really, a lot of time of enjoyment and kind of finding yourself, which was important, I think. But then actually getting into NHS, and one at that point I said about kind of skilling up in every avenue you can. So you never know. I never thought of kind of mental health, ADHD is a world I'd ever explore, but actually I'm an associate specialist in ADHD, so I actually work alongside a consultant, and I do ADHD work where I do what we call the stable follow-ups. When they're diagnosed, I see them to optimize their medication, but improve their sleep, nutrition, diet, and exercise. And this is an avenue I never thought. So I always tell a lot of my colleagues thinking about private, make sure you've kind of skilled up in every avenue you think is possible. It's quite easy to say, oh, I just want to do weight loss. That's great. But actually what happens when the opportunity comes where actually someone else comes in and says, oh, I want weight loss, but I want something else as well, oncology or cancer. So try and widen your net as best as you can. And then later on, near the end of the journey, when you've hit private, you can start finding a niche, but do it very wide, because especially we found in Cinnamon Healthcare now, D, my colleague who does obstetrics and gynecology, so he does women's health, an expert in that. And as a result, he did general practice, but he's got that special interest. So yeah, and those years of building up any opportunity, conferences, because the networks we form, I found LinkedIn is a wonderful tool to kind of get interaction. If because of the algorithm, if you actually formulate your bio well, you will get people contacting you on a daily basis. AI companies wanting to work digitally with you, private companies who want to collaborate with you to do work, blood testing companies or gene testing companies that all do well. So get a good profile on LinkedIn. It's hugely, hugely important. And you never know, any charity opportunities which I've had, which then opens out other doors, can be helpful. But yeah, as I went through every stage, it was quite good to build up those leadership skills. And then, of course, the big area of pharma, these drug companies who are willing to help and support. Obviously, there's an agenda from their side. They are, wanting to earn money from this, but actually patient care can be put as a priority. So you can do projects in collaboration with drug companies and pharma as well. But I would say, yeah, widen the net from the start, LinkedIn profile, and getting a group like Designated so that they can kind of take off the bulk of the stress. Because while we see patients, we need the PA system done, we need the accounting done, we need the billing done, we need the marketing done. It's very hard to employ people for all of these. Whereas actually, if you've got one package team, especially at the start of your journey, actually there's a good collaboration that can come from that, good learning. And look, if a year or 2 or 3 you decide to move on, great. Otherwise, you can actually mold the team to actually fit the purpose that you want to do to achieve what you want.
Excellent. That's great. Thank you very much. Key learnings, Levant, we touched on this earlier today when we met, in terms of some of the things that you've learned, I guess, along the way. And perhaps you just sort of touch on 2 or 3 of these in terms of, I know, your relationship with with D and VJ, for instance. It'd be great to understand how you met, perhaps, and how you formulated the idea, but maybe some other key learnings too.
Yeah, I guess this bit about the dark side, as people talk about, there's always this negative connotation when you're considering going private. And that's the first thing I'd say. No one knows your situation. No one knows kind of the family stresses or health issues or financial issues. So actually, it's all about yourself in that sense. You need to decide what works for you. And maybe, I've got colleagues who never want to go private, and that's great. But there's a lot of us that actually find, I would never fully go private, but certainly a few days a week would be lovely. So finding out why you're moving, and also not feeling guilty about that, is hugely important. who and how you collaborate is also important. I have 2 partnerships, NHS partnerships, where I have 4 partners in each side, and I've liked to think that over the last few years, picking up what makes a partnership work, similar to what makes a marriage work, because that is what we are like. And I think the main thing to appreciate there is, for me especially, is hard work. I love having 50 things going on at once and running here and doing that. There needs to be an understanding, but in that team you need the people who play a role. So for example, I would say probably more the principal. They'll kind of speak into companies, trying to get the collaborations going, trying to bring in special projects and income that way. I know Dean, my partner, is more the leader. He's the one that speaks to, gets all the meetings arranged, keeps us in check, almost like the headmaster of a school, but in a respectful way. And then we've got VJ, who's very, very versatile, able to give up time at the drop of a hat, and very IT digital associated as well. So some of the intricacies and contract reading, we are getting a lot of contracts that we have to read through. I'm very blasé about it and have to trust the judgment of people like VJ. So everyone has their role. And as a result of it, I guess you've got to be willing to jump a little outside of your comfort zone. So this opportunity with Aurospace that we're having now is a wonderful opportunity. Even today, having those negotiations and discussions about setting up in Spain, which is wonderful to hear. But all of those, they take time, they take effort. And I think the important thing is be open for opportunity. Like I said with the LinkedIn, if someone says, oh, look, there's not going to be money straight away on this, but we would like to collaborate. We're an up and coming company who are doing kind of digital work in private. Why not give them a go, or at least give them a meeting? There is enough hours in the day. If you can fit it in, NHS, you do it in the morning, and maybe at lunchtime for a half an hour meeting with these companies can be quite helpful. So I think for the learning side of me is be very open at the start. You do have to value your time. I think that's part of the problem, that sometimes if you try to do too much, people may kind of abuse your time, and you've got to be mindful of that. But generally, I do find when you're starting up in this private world, you have to be very, very wide and open and take opportunities early on. Financially, you've got to be sensible. I guess you can't just kind of throw money into every opportunity. But on the flip side, I guess if you don't commit some level of finance, you don't know where this is going to go. Is that stone or door going to be turned? And you wouldn't know if you haven't quite pushed it. So set limits in the sense of how much can you push it. And that's particularly why I wanted to go in a group practice, because there's only so far a one-man band can do. When I was having about 25 to 30 patients, of course, when I'm on holiday and they're contacting, it can be quite stressful. Whereas a group practice, you're suddenly bringing in other interests into the team and widen your scope of practice. But also there is that stress level. If it's like a financial thing, it can be split 3 ways, because now our clinical system that I use no longer is just paid by me, it's paid by 3 of us split, which is lovely. So I think I would normally say, if you're thinking about doing it on your own, do think quite hard. And I know there's always a risk with partnering with people, but if you can find that hard work ethic and similar mindset of what the vision is, it works so well to actually push you further on your journey, and also makes actually things quite interesting. It can be very isolating doing solo practice. Those couple of years when I was on my own, going to Harley Street, sitting in a room on my own, no nurse cover, no support there, it can be quite isolating and then stressful. Whereas now actually running through cases, sometimes saying, look, can you cover this? I'll do this, can work quite well. And utilize this opportunity, because we are in a wonderful time, not only in medicine, but in digital, with the use of AI. Now, in terms of gene testing, in our medical school days, we were only learning about a couple of genes, but now we know we can now get 8 gene testing done. I can get an ultrasound scan and an X-ray to your house. I didn't try to organize an X-ray recently for someone who lives in a farm. It's wonderful opportunities where digital is now meeting medicine, and this buzzword of functional medicine or lifestyle medicine, where we can check gut microbe, checking magnesium levels in blood. All of these kind of factors are now moving the dial in private. So it's a great time to consider private, but I would say, skill up, be the best you can, do a lot of conferences, open your network, and then when you're ready to make that jump, find a team similar to Designated, and where you can actually have a lot of the stress taken away from you, especially when it comes to CQC, finances and marketing, so that you can do what you do best, get on, practice your medicine, and from there build up your patient list from good feedback, because you're giving them that time.
Fantastic. That has been really, really insightful. Thank you. But one of the things I wanted to touch on was today was around, the stages of growth, and when you start out, what your needs are going to be, and the support services you're going to need to be very different as you start to accelerate. And I think that's been the case with Cinnamon, correct? Where when you were on your own, obviously what you need is very different. Now there's three of you, you're growing, you've got these opportunities in South London and internationally. And, the way that Designated is set up is that we're designed to let you free your time up so that you can focus on the patients, and let us control the back office. But it's just as you go through these stages of launching single practitioner, and you touched on, we often speak to doctors who are just starting out in private practice, and they will turn up at a clinic in central London with practicing privileges, and they may see 3 patients all day. And it's a kind of rude awakening in many ways, but that's obviously not, that's just starting out. Things change quite quickly. But perhaps you can tell us a little bit about, your journey with Cinnamon and how your needs are changing as a clinic.
Yeah, I guess, I think we anticipated, with, marketing and social media, probably we'll be getting those calls. No one could get a GP appointment, so they're just going to be contacting us. But actually, at the end of the day, it's a free service. So people are still going to be calling their GP, happy to wait for that week or two. So actually now we're finding that the way forward is probably more of this preventative medicine side. So we'd still keep that avenue open, that people can contact us and we can make time. But I guess the balance really now is, with 3 of us, we work, all 3 of us work full time for the NHS. So how do you make that time privately? So we're more of a kind of, look, they need an appointment today or tomorrow? Yep, we can change things around and see them. I guess the dream or the vision would be actually to drop a day or 2 and have that availability. So respectfully, we are actually available, all week, so that we can actually see these patients almost as they walk through the door. But to create that, there needs to be a steady form of income. And this is where this idea of kind of packages, where patients can kind of book in for their women's health clinic. There'll be an ultrasonographer who will do the scans of their breasts and their womb. We would take the blood test. We will do that counseling session. But that's how we're kind of envisaging where a steady stream, because exactly like you said, Simon, that is the shock. People assume, you go private, you've probably been given loads of lovely compliments. And I was in a similar position. I have a NHS population of 20,000 patients who all said, oh, when you go private, that's it, I'm going to come over. And many of them do, but a lot of them, it is very, very difficult because there's still a free NHS service available. So I guess just be mindful that actually in the initial stages, you're not going to be getting 10, 20, 30 people walking through the door and a steady income. It's going to be a bit hit and miss. And sometimes you may actually have to undersell yourself a little bit. Maybe actually that form or that patient to see, it's probably not worth it, but actually the connection. I know Vijay had a wonderful example last week where he went and did a home visit and saw a family, and they were absolutely wowed by the way he treated them, that they were like, right, next time we're definitely going to call the team. So actually you're almost like an advert every time you see that patient, if you're confident with your skills. So our ethos as the 3 of us is, look, any opportunity, anyone calls, we see them, whether we see them face to face, whether we do virtual or go and do a visit, we are available. And then, of course, when the confidence comes, when the reputation builds, we will be in a more comfortable position. And that's like my ADHD colleague, Dr. Fairvan. He started very small, but as a result of actually people talking, he's not done any marketing, he's not done any social media, and he has, a company that's turning over $1 million. And that's just based on him and good work that he's doing and the word of mouth. So important to see where value is, and also, realizing your value, that at the start, it is quite hard work. You do have to give up a lot of time. Sometimes finances, if you're doing this all on your own, if you're not getting a VC or some sponsorship money, you're going to be plowing this money on your own. But actually, you can do this very sensibly. You 100% of the company, which is very, very helpful, and it can fit your hours. You can say, look, I still need to keep my NHS going for mortgage purposes and learning, but actually, you know what, that Friday half day or that Friday full day, I can give up. And remember, it's not ever wasted. Just because you're not seeing a patient, you use that time to grow. I know even my NHS work, I have a Thursday morning off, and it's just for me to breathe, for me to call up AI companies and discuss how I'm going to improve the practice. And as a result, our income in our NHS practice and our quality of life has improved tenfold. And that's because we've had breathing time. So never use or think a time half day when you're meant to have patients seeing and you're not seeing anyone. It's a waste. Use that time to find out, okay, who is the company we can use for blood testing? Can we negotiate a better price? Can we make a new idea? Can I go on to ChatGPT and formulate it, send it to the marketing team to create for next week? So use that time wisely.
Fantastic. Thank you. It's been really, really helpful. I think one of the core things you touched on was around knowing your numbers and about, you are moving into private practice, you are looking at a private healthcare business, and you need to run it like a business. So you do need to think about budgeting and finances. And we often work through with our doctors the kind of like the different revenue streams they're considering. So it could be initial consultations, review consultations, telephone appointments, procedures, etc. Mapping those out. What are the anticipated revenues over the course of year one, year two? What are the cost of sales of delivering that service? Are you going to be paying a nurse or another doctor to deliver that as an associate? And then thinking about your overheads. So are you going to employ anybody? We'll come on to that in just a minute. What about your kind of rents? What about your professional fees? What about your CQC registration? You're going to need an IT infrastructure. So you're going to need a practice management system. You need a phone line. You're going to need email. There are certain things that you're going to need that you need to factor in, so you can sort of build a budget and build a forecast. But you shouldn't be going into private practice without knowing your numbers, and at least having some kind of financial plan. And then Lavan, we touched on this a little bit earlier with the operational structure, and I'd say what I've demonstrated here on the slide is more a kind of year two type structure, where you're up and running. You're kind of like you're the founder and clinical director. You've just decided to bring on a second doctor and a nurse, but you will need to think about who is running the business of private practice. If you're seeing the patients, who is looking after the numbers? How many new patients have you seen this month? What's your total number of patients? Total revenue? What's your average revenue per patient? Are you going in the right direction? What about your CQC compliance? Who's going to be answering the phone at the weekend? And I spoke to Dee about this earlier, where if a phone call comes in on a Saturday morning, for instance, who's picking that up? Because it may be an inquiry and they need to be seen that day, but they're not going to wait till Monday morning when the office opens again. So you need to think about the kind of the back office support you're going to need. And then more on the commercial side, likewise, who's going to be doing the marketing, who's looking after your website, who is putting your name and your clinic out there that's going to attract those patients. And then, of course, bookkeeping is important, tracking transactions, both kind of incomes, but also costs. And then you're going to need an accountant and finance at some point throughout the year as well. So, this is more of a year two. Year one would be a kind of more slimmed down version of this. But again, Lavan, perhaps you could sort of touch on, the way that you, VJ, and Dee split roles and responsibilities, and who does what within your practice.
Yeah, so I guess when it comes to patients, it's kind of anyone, and the difficulties, obviously, as you can imagine, there may be an NHS patient that is well known to me. In terms of the way the GMC in this country works, you can't actually see a patient privately if they are under your NHS thing. So normally that would be passing on to one of my colleagues, one of the two, to see. But yeah, normally, we have a system where it's whoever's available, and that probably needs more structure over time, because right now it's where the time is and who can help and jump in quicker. So it's kind of a caring model where actually, look, calls come in, who can take it, a message goes out, and that's the designated to pick up it through our PA service. A WhatsApp will go on, yep, we've got a call, or we've got this, who can take it, and we can adjust our schedules accordingly. But we do have our roles. For example, I have the access to the money, I have the bank account. That when it comes to payments, invoices, actually, I'm the one that does that. And I do that actually for my practice for the NHS. So it just seemed logical that Lavan just carries on with that. So that's kind of my side of it. So when an invoice comes, Dee knows I don't have to stress about it, or should I forward it on to Lavan and he'll get it sorted out. A lot of the digital and kind of marketing and thought process and documents, creation is normally done by Vijay. He's kind of more particular in terms of how he likes things laid out, and critiquing some of the documents we get. He's much better at that. And then Dee, kind of everything else flows through him. So kind of organizing meetings, like you said this morning, Simon, kind of the first man to kind of approach that and correct things and respond best. He's that guy. We just don't want to miss opportunities from that. But as time goes, as you said clearly, we want to get a little bit more managerial, where we can sit and bring in doctors and nurses to support that. But at the moment, you can imagine that first year, like you hear with most CEOs who are running companies, you do a bit of everything. You're sometimes picking up the phone and speaking to people. You're sometimes doing admin. You're sometimes doing a form. that comes with the territory, and that has to be done. That's the whole point of building resilience, building confidence, and understanding the company. If I didn't know the finances, if I then pass that on, it's not right to me, because actually I've learned the system and I understand. So very important at the start to kind of be very wide again and kind of understand all elements of the business. But as time goes on, you can start delegating and putting that through. So yeah, if it means someone's calling on a Saturday, one of us will have to pick it up. But actually, as time goes on, maybe finances are better. Rather than paying, PA service for, say, a Monday to Friday, it could be an all week service, which is quite.
Yeah, excellent. And while we touch on that, often people think, well, I need to employ staff. That's the first thing. I need to employ a medical PA, or I need a practice manager. Well, there are different options out there, and they all have their pros and cons. So, of course, if you employ someone, great, they're going to be dedicated to your clinic, working Monday to Friday, 9 to 5:30. But to start with, they may not have enough work to do. So you may not want to have somebody full time, and it can be expensive. So they are going to be committed to you. You're going to have a lack of flexibility. So, what happens if they're off sick? What are you going to do around that? So you're going to need, you're an employer. So therefore you need to think about the HR responsibilities. You need to think about the insurances, pension contributions, national insurance, and that recruitment time and cost. What happens if they leave after 6 months? What's going to happen? On the flip side, you've got the opportunity to hire someone on a freelance level. So you can go to LinkedIn, as Levan suggested, and you can put an advert out and get some people in, and they can work, perhaps 5-10 days a month for you working. But again, they're not employed by you. But also, what happens if they don't answer the phone because they're on the phone to another clinic, or they go off sick for a week? You're going to then need to jump in to basically help that person. The Med PA service, like the one that Designated offers, and there are many out there, is a good option, I think, when you're starting out, because it's a lower cost option. You get the flexibility in the packages. The PAs will often work in a team, so there's sickness and holiday cover should you need it. You're not employing them, so we're Designated. All of our medical PAs and practice managers are employed by us, and you don't need to worry about national insurance, pension contributions, all the things that you need that come with employing someone. So, and just that ability to flex over time. Now, I'd say this service, we typically would recommend, this to start out with. But once you get really busy in your year into year two, and actually there's enough work to be done, then maybe the employee route is more attractive, because there is enough work for Monday to Friday, 9 to 5. And you do want to grow that team as part of your vision that we touched on earlier at the clinic. Maybe you want to have 10, 20 staff, especially if you're expanding and growing, as Levan suggested earlier. So to summarize, I'm going to let Levan do this, because these were his points that he sent over to me. But hopefully today has been a really useful exercise in a real life example, really, of someone who has gone from the NHS into private practice, both firstly solo and then into Cinnamon. But Levan, perhaps you could just sort of touch on some of these points just to summarize and close things off.
Yeah, I highly encourage people to consider private practice, even for a day a week. I think doing the full NHS, I have to say, I found more value in myself, or I valued myself more after going into private, because I realized actually I'm not too bad at this job, and people actually respect and enjoy consultations with me. And there's a value there that I can provide that I can't quite do it in the NHS, where there's a kind of expectation from the patient. You are working for the NHS, so I demand, which, we're there to serve. There's no question there. But actually, sometimes it's quite nice to reflect on yourself and see. So I encourage everyone in any field they are to dabble at least a little bit in it, whether that's through privileges or whether that's setting up on your own or in a group. And definitely having that group has made a massive difference. It's just a joy. Our meetings are a joy. There's going to be some laughs. And sometimes I'm sure some difficulties. Sometimes when you're putting money in, it can be quite difficult conversations. Who puts more? Who does that? But at least if you find the team and think of it like a marriage that you feel you can connect with, definitely I would encourage you to go as a group rather than on your own. But obviously that's how you want to do it. Set that vision up. What are you there to do? Is it actually you want to create the company, make it big, and then sell it off? And that's fine if people want to do that. Our vision's different. We want to provide the best care we can. We want to make sure we have other services available. We want to create friendships, networks, and collaboration. So different where you go, but remember to be able to flex. Don't immediately just think, I want to do pediatric general practice, full stop, because there will be lots of opportunities you'll miss if you're that narrow. That can be a big part of it. That can be your niche, but definitely offer other services either with yourself or with colleagues. And then, yeah, where are you going to sit on the market? If you have that niche, maybe you are going to be the best the best ADHD specialist in the area. But actually, that can die down very quickly. We know now with companies like 360 ADHD and others, they're coming in and taking the big share of the market. All of a sudden, you could find, well, I was the best at this, but now everyone wants to go cheaper. So just be mindful that you need other bits in your setup. And then, yeah, CQC. It's not as traumatic as you may find with NHS. I've obviously gone through it many times with my NHS practices, and it can be truly traumatic. But actually, this is more, just trying to be safe. And I think it's an important point. I know people have their questions around it, but I think, it is important to have CQC because these are patients at the end of the day. We want to make sure we're safe. We want to make sure there's a body in terms of supervision. And then, yeah, who's doing all the various roles? You do need to have some level of idea. That may evolve. You may not know at the start, but quite quickly with the personalities, you probably know where everyone sits, and everyone brings something different to the table. I mean, I've had my experience as a partnership, so I know D and VJ value all of my words and wisdom and experience, but actually, D's had wonderful experiences in his life in terms of maturity, private practice in his own right, working for other companies. And then obviously our situations, social situations, VJ is not married currently, he has a fiance and no kids, and actually that can be quite helpful because we're setting up who's going to do those late nights. If there is a wonderful opportunity for a home visit to see 3 patients, we can be, great income. Who's going to be that versatile to flex? So just think about where you are in your life journey as well, can be helpful. And then finally, what is the point of all of this? Well, I love my NHS work. You could almost argue, why would I even give it up? Because I love it so much. I'm off tomorrow, but I'm heading into work anyway to catch up with the staff, see how they're doing. But it is that mindset of NHS is great, but actually having this extra feather in your hat can be so useful because you just never know that one opportunity may land on your lap. And we were talking about this with Oru today. I had a meeting with the Oru team today, and their vision of of expansion and them asking us to come along with that journey. We were very fortunate to meet them so early on. So it is that idea that you need to be ready to be in your NHS because the learning you get, the pathologies you get, the relationships you build is, second to none. However, the best advice I would say is try and have both going on at the same time, whether it's a 3 and 2 day, whether it's a 4 and 1 day. But the joy is having a wide range in your life so that actually it is that fulfilling career that you wanted. And that way you can flex a little bit more, where actually on that private, now that you've got your NHS confidence, now that you've set up privately, actually, oh, look, I've actually wanted to get into pediatric medicine all these years or dermatology. Well, now I have the capability and I've got the reason for it because actually there is a demand in private. Great. I can see the volume of patients to skill up on that area, but now I can use that, take my equipment and use that in private. So I would definitely encourage going private at least a day or two, but also definitely keeping NHS work in the background.
That's great, man. And we hear that a lot, with the multiple calls that I've had this week, that I don't want to give up the NHS. I love what I do there, but I just want to expand my horizons. I want to, to treat patients the way that I want to treat them. And I think that diversity is definitely a theme that we see with the doctors. Very, very few say I'm moving out of the NHS and I'm fully private. That is a real rarity. Just to finish off, we had a few questions come in. Please use the chat function if you want to ask Levan or even myself a question. Perhaps we'll just pick a couple of these because I appreciate that we're running over a little bit. Pick and choose which one you want, Levan. I was going to say perhaps we could talk a little bit about the biggest benefit, because we touched a little bit about partnership and starting on your own and what you'd recommend. But what's been the biggest benefit of moving into the private sector?
I have to say, because I'm always a big promoter of learning and teaching, I think it's just been a massive learning actually in terms of medicine. I went to America last year on this functional medicine conference, which was mind blowing. It's one of the best conferences I've ever been at, and I do a lot of talks nationally for kidney disease and diabetes. But actually now my interest is going into sleep medicine. There's a lot of scope there. And now, I've got my first talk as a national speaker for sleep, but that developed because of my private medicine. That was a very innocent, in a background kind of thought. And now actually going on my own journey in terms of optimizing sleep to try and improve my ADHD work, as in trying to get patients to sleep better, to come off medications. It's been so actually in terms of a learning, I think it's the best thing. You can actually go into a niche and skill up more. In the NHS, it's so generic sometimes and sadly so restricted. You don't get that. So I'd say number one, it's been the learning. That's been a joy. And then number two is just seeing the opportunities that were never available on the NHS. You can't get those opportunities on the NHS, sadly. But now privately, all of a sudden, these kind of shoots, these seeds that we planted, we're now jumping onto those and saying, look, we can really make something of this. The idea of a subscription service, an annual fee or a monthly fee, where they can have access to us, when they need, but we will also provide an annual health check where we thoroughly assess them, get the scans done appropriately so that we can give them good, reassuring medicine so that they can walk away saying, look, I feel very fulfilled. I had a lovely consultation. The doctors reassure me I'm back next year for a follow-up.
Great, thank you. And then a couple just to finish off with would be, how long is it taking you from sort of that initial idea to starting to kind of see patients under CQC? What kind of time frame are you typically looking at based on your experience?
So I think if you put kind of ballparks of, so up until a year, it can take as long as I'd say, but like in my own personal journey, it took 3 months. Anywhere between the 3 to 12 month is normally that journey to the point of starting to get there, and seeing patients. Once you're CQC registered, you can see straight away. Online can be done straight away, and then you can obviously move face to face quite soon after that if you're comfortable, got your premises, and can review them.
And then biggest cost, so that you perhaps weren't planning for or unaware of, what would you say that would be?
I think CQC is obviously a big one. Your clinical system you'll be paying for as well. So there are a lot of initial costs, but you can speak and negotiate. We speak to a company, a clinical system, when we've asked them to, can they push it 3 months down the line, just as we're starting up. With our oral space, our colleagues here, we've said, look, can we just pay a little bit later? We can't pay immediately. People are very keen. If they see the energy, if they see the keenness, if they see the potential, people are willing to compromise. Is it a monthly payment rather than straight away? Can deposits been shifted away? But definitely, you need a clinical system, you need a blood testing system, you need scanning system. So these are all initial costs, but you can always start very low and negotiate.
Yeah, and I think with the practice management systems, if you look at the new technology and systems coming out, they're cloud-based, they're far more flexible. There is no setup costs where there used to be. There is just a monthly fee, and if you don't like what you're using after 6 months, you could switch into something else. So I think there are these new breed of practice management systems out there, which are making it, actually, when you think about the workload that it takes on, are very cost effective for running a private practice. So and if anybody wants any help or recommendations relating to that, then obviously do get in touch with us. Levan, thank you so much. They were really, really helpful, really insightful, and thank you for being so honest, I think, and being so open. I know you said you were going to be open and honest today, but you really have been, so thank you. Following on from that, next steps. So do get in touch with us if you are thinking about moving into private practice, or you're already moving and you want just some advice and guidance. Very happy to set up a call either with myself or one of my colleagues. We can bring in one of the specialists in our area. We want you to succeed. So, it's our job to help and educate you, like we are with this webinar series, to get you on the right track. We do have a private practice WhatsApp group. So again, this presentation will send round, so feel free to join that. We're trying to encourage people to kind of share ideas and experiences, and we've got a number of them who are putting posts up there about CQC or best marketing. So do join that group. Our webinar series has been really successful, both obviously people attending, but what we're seeing is people who are watching it in the evenings and the weekends in their own time. We know you're very busy doctors, and not all of you can join us at 6:30 in the evening. We are going to run a couple of lunchtime ones with, I think, Healthcare Today coming up in sort of September, October and November on a slightly different kind of level, but do register for the webinars that are coming up. The next one we're doing is a slightly different one. We haven't covered this before, but we are starting to, I guess when we talk about vision with a doctor like Levan and VJ&D, it's, what are you looking for? Well, fast forward 10, 15 years down the line, maybe you are thinking about, the next stage of your professional career, and you are thinking about exiting. So what are those kind of key considerations you need to think about? How do you build value in your practice going forward, so that when you are ready to move, you're able to kind of pass on something which is, both sizable and valuable, and you can benefit obviously financially from all that hard work that you've put in. So that's on Thursday, the 18th of September at 6:30. We'll send a link round to that over the course of the next couple of weeks. We are taking a break in August because I'm on holiday, and I'm sure Levan's on holiday as well. So we are going to have a break for August because we know it's a quieter time for everyone, and we'll be back in September. I think that's everything for now, but there are contact details. Again, thank you very much for attending on a very warm Thursday evening in July. I know you've probably got better things to be doing, but we really appreciate you showing up today. And firstly and lastly, a massive thank you to Levan for a really brilliant presentation, and just for being so honest about his experiences. So thank you very much, and we look forward to seeing you next time.
Thank you, guys.